Each year, osteoporosis causes around 2 million broken bones in the U.S. alone and threatens 1 out of 2 women over the age of 50. A new survey shows while 3/4 of Americans say they are aware of the effects that osteoporosis can have on their health, only just half report taking any steps to prevent it.
May is National Osteoporosis Month, and to raise awareness of this devastating disease, Dr. Andrea Singer, the clinical director of the National Osteoporosis Foundation, is here with important steps for improving bone health and preventing osteoporosis. Dr. Singer, thank you so much for joining us.
Thanks for having me.
First off, tell us, what is osteoporosis?
Well, 54 million Americans either have osteoporosis or are at risk for having osteoporosis, which is a disease that causes low bone density, which leads to weakened bones and an increased likelihood of breaking or fracturing a bone.
And who would you say is at risk for developing osteoporosis?
There are a number of risk factors that places a person at risk for developing osteoporosis, and those include age, as well as family history or genetics, especially the history of a hip fracture in a parent. Being of low body weight, which often means smaller, less dense bones, increases risk. Smoking or excessive alcohol intake, as well as not getting enough calcium or vitamin D and being inactive, can all be risk factors which can increase the likelihood of having osteoporosis.
Now, is there anything we can do to lower our risk of developing osteoporosis?
There are a number of things that we can do to lower our risk of developing osteoporosis and of having a fracture. We can eat a healthy, well-balanced diet with adequate calcium and vitamin D, fruits and vegetables, and not too much sodium or caffeine. We can stay clean and not smoke or reduce our alcohol intake. We can get active, so weight-bearing, muscle-strengthening exercise and avoiding the risk for falls is important. And we can get tested, so we can speak with our healthcare provider about getting a bone density test or a DEXA scan to help evaluate whether or not we have osteoporosis and help assess our risk for fracture.
Okay, what is a bone density scan and who should consider getting one?
A bone density scan is a painless, non-invasive, quick test. It takes about 15 minutes that assesses bone mineral density, and by doing so can diagnose osteoporosis and help evaluate the risk for fracture. The National Osteoporosis Foundation suggests that women over 65 and men over 70 should have a bone density test based on age. Younger postmenopausal women or men between 50 and 69 may be candidates for a bone density test based on additional risk factors.
Where can people go to find more information?
For more information, we can go to boneawareness.com.
We hope women will use this month as the perfect excuse to contact their healthcare provider and get a bone density scan. Clinical Director with the National Osteoporosis Foundation, Dr. Andrea Singer, thank you for joining us.
Thank you for having me.